For the invitation. And again, sorry we couldn't do it on Friday. But and again, if there's another time, we're happy to give a talk. Certainly, evenings always work, and with notice, we can also make weekdays work. So my name is Jeff Mann. I'm an orthopedic surgeon in Oakland and Berkeley, and I'm going to talk about health solutions to the climate crisis. So, sorry, I'm trying to move a box here so I can see a little bit better. So, the group I'm involved with is called Climate Health Now. It's a group of health professionals concerned about the environment and the effects of climate change on our patients' health. About the time of the climate strike in 2019, our two founders, and they're pictured there, Amanda and Ashley, arranged for a group of health professionals to lobby the offices in San Francisco, including Speaker Nancy Pelosi, Senator Dianne Feinstein, and then Senator Kamala Harris. And that picture on the bottom is actually us in Kamala Harris's office. So very, very interesting and timely now that she's running for president. So our message at that time was that the changing climate was a health emergency. On that day, we realized the power of using our trusted health voices to advocate for the climate. And that's what we have done since then in the last 4 to 5 years. Our group has continued to grow, and we now have 500 members, health professionals in the state. So what I wanted to talk about is the effects that climate change is having on human health, and make a connection between climate solutions and health solutions, and also how we and other healthcare providers are advocating for the climate. So these are all the huge number of impacts that climate change has on human health. And of course, I'm not going to go over all of these. I'm going to focus on ones that are the most prevalent and that we see the most: extreme heat, severe weather, and air pollution. I'm going to start with extreme weather events because these always grab the biggest headlines, as you can see here. The way that they categorize weather disaster events is those that cost at least $1 billion. For years and years, the average of $1 billion events was about 7 a year for many, many decades. But in the last 4 years, there's been over 20 or more of these $1 billion weather and climate disasters. And although climate change does not directly cause each of these, it worsens essentially every one of these. This is what happened in 2023. You can see that there aren't quite as many events in the West, but usually we have our share of fires and other weather-related events. We got a little bit of a break in 2023, but as you can see, these are occurring with increasing frequency. Last year, disasters displaced more than 3 million Americans, according to census data. So what do we see on the healthcare front from these extreme weather events? Well, we see contamination of freshwater supplies, we see infrastructure and home loss, disruption of food supplies, and also disruption of supplies of medical and health services for weeks or months. So imagine if you are dependent on different medications, if you have renal dialysis. There's so many people who are dependent on their medical care, and it's not available for weeks or months at a time. And these photos that I have here, these, they're not from New Orleans during a hurricane. This is actually from Tracy, California last year, and from Capitola last year. So these events directly affect us where we live. Extreme heat is actually the leading cause of weather-related deaths, and you can see that from these headlines. That heat dome that occurred in the Pacific Northwest, which is pictured on the upper right there in 2021, that was responsible for about 1,400 deaths in the US and Canada. And this was also a watershed moment for climate scientists who never thought an event like this would be possible in the Pacific Northwest, let alone at this stage. Of course, we have these heat domes that occur in our state as well. This in September 2022, we had this huge heat dome, and then also in July of this year, weeks of temperatures well over 100 degrees. And again, what do we see from the health standpoint? For every one of these hot days, there's more than 80,000 excess emergency room visits. So that's really a lot of people who are affected by extreme heat. And it's not just, the direct heat on our bodies, but the hot weather affects and kills people by stopping the body from coping with existing health problems like heart and lung disease. So this picture shows all the different areas of the body, essentially every organ system that is affected by heat. And of course, wildfires were very, very well aware in our state. The fires are getting bigger. 9 of the 10 largest fires have burned in the last 7 years. Fire season is getting longer. We are having fires in November and December. Fires are burning hotter and they're more destructive. And the result is that more people are getting exposed to the health harms of fires. And we're just starting to see a lot more research into this. A study that just came out this week indicated that might cause 5 to 15,000 excess deaths in California. A lot of that is because of the pollution associated with the wildfires. Um, Clearly, a third of the damages from wildfires are health costs. And fires cause health disruption as well. A few years ago, Santa Rosa, one of the hospitals there had to be closed down for 17 days in 2017 and a week again in 2019. So again, healthcare disruption is occurring near us because of these natural disasters. Air pollution is one of the greatest causes of health problems and probably the greatest cause of health problems in the world. Air pollution is made up of smog, which we see on the top picture, and soot. Both of these occur from the burning of fossil fuels. Now, soot is these small particles that we call particulate matter, PM, and the very small ones, these PM 2.5, they're 2.5 microns. There's a picture on the lower right, the size of these small particulate matter, small particles in relation to human hair. And the reason they're so dangerous is because these particles are not filtered out into the lungs. They go directly into the bloodstream and they spread out to all of our organ systems. And the studies have shown the association between these small particles and diseases throughout the entire body. And again, I'm not going to read all of those, but every system in the body is affected by this particulate matter. This is really a landmark study that came out. It came out in 2021, and it looked at the year 2018, and they were able to distinguish the particulate matter that came from fossil fuels versus particulate matter from other sources. And what they found is that fossil fuel air pollution was responsible for 1 in 5 deaths worldwide. That's really a huge number. This was double the previous estimate. I'm going to get back to this study in a couple of minutes. This map shows where a greater percentage of people are at risk of dying from air pollution. Not surprising, in India and China, they're the worst, but here in the United States, we are at risk from bad air in our country. Around the globe, it's estimated that air pollution takes 2 years off people's lives, and in India, 10 years off the average person's life. So really a huge problem. And of course, this is a huge environmental justice problem as well. We see firsthand about this. Health impacts of climate change disproportionately affect low-income communities and communities of color. People in these populations often have pre-existing health conditions, and these communities are often living near industry and refineries, and they're exposed to harmful air and water. So healthcare providers have realized the important link between climate and health. Seems obvious, but something that we really haven't focused on until really the last decade or so. Warming of the planet is causing health problems throughout the world. And the good news, now we're going to sort of switch to the good news, and the positive part of the talk is that we have solutions and they're available right now. These solutions are beneficial to our health and to the health of our planet. So that's sort of the the focus of the talk, climate and health solutions. So again, these are the solutions that we have, and they're available right now. Solar and wind power to electrify our grid, battery storage, electric cars and trucks, and electrifications of homes and cities. So, and I'm going to get to those solutions in just a minute, but what I want to emphasize here is that our country and the world, but especially our country, has taken big initiatives in the past to improve our environmental and health. The Clean Air Act is really a landmark in this area. So this has reduced pollution by regulating 6 pollutants. So that's what we see on that table on the right, that over the 30 years since it was implemented in 1990, these pollutants have decreased dramatically. It has been estimated that the Clean Air Act presents over 370,000 premature deaths a year, and it saves trillions of dollars in annual economic benefits. So again, this has been done in the past, and now this is what we need to do now. We need to electrify our energy grid with renewable energy. And this is a study from the Goldman School of Public Policy, which is over at UC Berkeley, and it shows what potentially can happen with a program like this, electrifying our energy grid. And it evaluates the health and environmental impacts of such a program. And again, similar to the Clean Air Act, it really had dramatic results. So with a 90% clean energy grid, it reduces our CO2 emissions by 88%. And that's really huge because we know CO2 is the main cause of global heating. So if we reduce our emissions by that much, it's great for the climate. And it also, this clean energy grid reduces harmful pollutants, sulfur dioxide, nitrogen dioxide by almost 100%, huge amounts of reduction. So that's good for our health because these are really bad for human health. So again, climate and health solution. This slide shows that we are actually making some progress. We're not to a 90% grid yet, of course. If you look at the blue bars up and over the time frame, that's all renewable energy. So really, the estimate by 2030 is that, over half worldwide energy is going to be renewable. So we are headed in the right direction. Of course, we need to be faster, but it's still headed in the right direction. This is going back to that study that I mentioned earlier, showing that 1 in 5 deaths are from fossil fuel pollutants. And the second part of the study showed that China had actually cut its fossil fuel emissions in half over this time frame, and it saved millions of lives, 1.5 million lives in China and 2.4 million lives worldwide. So again, it's not just theoretical, but this is actually proof that cutting fossil fuel emissions saves lives. We're also realizing the health harms of living with fossil fuels in our homes from gas stove pollution. So natural, quote unquote, natural gas is actually methane gas, and it's an 80 times more potent greenhouse gas than CO2. Gas stoves also produce carbon monoxide and particulate matter as well. It's children in homes with gas stoves have a really considerably increased risk of developing asthma over their lifetimes and also during the time they're living in the home. So a climate and health solution is electrification of our homes, including our cooktops and our furnaces. Also, electrification of transportation. Transportation is the #1 source of US greenhouse gas emissions, and in California, it's actually 40% of our emissions. Switching to electric vehicles saves lives from the decreased pollution. It also saves $1 billion in health costs, and it lowers our greenhouse gas emissions. Again, another climate and health solution. A plant-based diet, also a climate and health solution. Livestock production is responsible for on the order of 18% of all global greenhouse gases because cows belch methane. Land is deforested. There could be trees which help to absorb CO2, and meat is bad for our health. So a plant-based diet, healthier for us, healthier for our environment. Again, a climate and health solution. Going into that a little bit more in depth, this table shows that 20 servings of vegetables has fewer greenhouse gas emissions than one serving of beef. There's our climate solution, and our health solution is that eating less red meat lowers all of these health risks. So going to the advocacy part and the healthcare community as advocates for the climate. So the World Health Organization has been advocating for many years about the danger of about climate change to world health. This has begun to catch on in our country. The American Medical Association recently has come out with statements encouraging physicians to become leaders in fighting for climate change. And that's what our organizations are doing. I mentioned Climate Health Now. I'm also involved with an organization called Physicians for Social Responsibility. They've been around for about 40 years. They're a Nobel Prize winning organization for their work with anti-nuclear war movement, and they have moved into the climate and health advocacy space as well. So a few of the of our advocacy positions. So one of them is, of course, based on air quality in our state. There's going to be a lecture, a talk on Friday about this. But the American Lung Association has all of the every year they put out the quality of the air, and unfortunately, California and in the Bay Area specifically. Unfortunately, we have pretty bad air. We do have a lot of refineries around here. We have a lot of cars. And we also numerous studies have documented the health risks of people living in close proximity to oil and gas extraction. These are all health risks that have been studied and have been noted. So our group, Climate Health Now and Physicians for Social Responsibility, have been advocating for these and other issues. So Bay Area air quality, we advocated for limited particulate matter emissions from the refineries, advocating for electrification of new construction in cities and counties, also for setbacks and bans from oil and gas drilling and capping of orphan wells. I'm sure we all know these are very contentious issues, and with the setbacks. So hopefully we're headed in the right direction. Again, not quite fast enough, but we're heading in that direction. And we have advocated and engaged lawmakers at city, county, state, and national level. So that's some of the advocacy work group that we're doing. We also like to say that every election climate is on the ballot, and we are encouraging our colleagues and our patients to vote, to consider climate when they're voting, and to look at the candidates and what their records are on the climate. So just want to conclude with saying that climate change has important and dangerous effects on our health. We have solutions that are available, and being active and advocating for solutions to climate change are important for our health and for the environment. And thank you all for what you are doing.
Wow, that was very, very, very informative. I appreciate it. Thank you so much. I had a couple questions. One was, um, you said something about the fossil fuels cause deaths, 1 in 5 in the United States and 1 in 10, or what
So
was that in India?
yeah, so it has been estimated that the air pollution from fossil fuels leads to 1 in 5 deaths worldwide. 1 out of every 5 deaths in the world is a result of pollution from fossil fuels, mainly the air pollution from fossil fuels. So that's why that study was right, like really such a landmark study. People thought, yeah, pollution's bad, but now they're saying 1 in 5 deaths. And what they found on average, because of the pollution is so high in India, that people live on the average of 10 years shorter because of the pollution.
Mm,
And worldwide, probably 2 years less because of pollution. So it's really something that we need to address. And we are, that was why I talked about the Clean Air Act, but now we need to do more than that. We need to go one step beyond that. And we need to, you know, transition all of our gas and coal powered energy to renewables.
mhm. Yeah, and then there was something else too. I was wondering um you said something about, I didn't realize that stoves created particulate matter.
Mhm.
Can you talk about that a little bit more? Because that's not something I've heard. I know that the smell, the gas is not good, but I didn't realize it puts particles out there too.
Yeah, the burning of the methane does that, but also the cooking also does the particulate matter. So, and carbon monoxide. So the
Mm.
actual cooking does that, the particulate matter.
Oh. Mm.
So, it's really important to always have your ventilator on, the hood, the vent, whenever you're cooking, if you have a gas stove, always have the vent on or have an open window, or also, cook on the back burner. So those are all things that can help.
How does a back burner work?
I think it
Oh, because
just
it's not
the
as
hood,
close to you.
exactly, it's not as
Um,
close to, yeah. So those are
mm,
things that can help. So, and then we're probably aware that there was going to be a ban, or there were at times bans of new construction from
mm.
using methane, and those have been overturned. And so they're looking at other ways to try to change that.
Jack, you're talking and you're muted.
Would the particulate matter be different with an induction stove, or it'd be the same as far as the cooking of the food? It seems like it would be the same, right?
Yeah, that's a good question, Jack. I don't know the answer to that. That's probably something to look into. I actually do have a friend who does research in that. So, it's certainly a lot of it is just the methane itself. But yeah, there's probably still some particulate that occurs from the cooking. So that's a good point. Something that I'll have to clarify.
Do you know if there's any cities that have banned open outside cooking?
Um,
Because it's just everybody wants to have a little fire in their little pit. And I know, I mean, since I have asthma now, since COVID, like, you know, I just don't understand why people do it. My husband's quit barbecuing decades ago.
yeah.
But yeah, so I was just curious if you knew anything
Yeah.
about that.
Most new construction doesn't allow wood burning fireplaces.
Mm,
So essentially all of them are, you know, are still gas fireplaces, but they're enclosed fireplaces. Um, I don't know if there's a ban on burning fires outside. I don't think there is, except for on spare the air days.
right.
But getting people to change their eating habits and barbecuing habits, and that's hard work. right? I mean, even when you look at, you know, if you look at how bad red meat is for you, even telling people to eat one less hamburger a month or something, and it's really hard to get people to change what they're doing. And yeah, it's nice to see the open flame and have a fire, but look at the possible side effects. So that's a hard one to regulate.
Yeah, it would be nice if cities could start just educating people
Hmm.
on what that does for everybody else. Because I know, like, when I go for walks and like people are barbecuing, I'm
Yeah.
like, or like they have their fireplace going. I used to love all that, but I mean, in a way, I kind of feel like there might be a time when that might be our only option, but we're not there. So yeah.
But that's why we're here
Wow.
is for education, and that's why we try to talk to, different groups of people, and we talk to people in government, and we talk to civic groups, and just trying to educate people on, the health harms of some common things that we do.
Yeah, that was really a really excellent presentation. Thank you.
Thank you.
Does anybody else have any questions? Karina, a
Yes, I
public health
do.
expert here?
Dr. Mann, that was excellent. I mean, I really appreciate the comprehensiveness of your presentation too.
Yeah, thank you.
So one of the questions I had, one of the things I've been curious about, during floods, you see people just walking through, water at knee high or whatever. And so I've always wondered about what about like bacteria and parasites? Do you know if that has been studied or looked at?
Um, Sort of depending on where the flooding is. Yeah, no, that can be really dangerous, because usually when there's a flood, again, depending on where it is, if it's you know um a lot of water treatment plants get
Yeah.
polluted, right? That's why you can't there's a lot of warnings for not drinking your tap water, and you have to boil your tap water. So that can be a huge problem. But anytime any industry, or a dairy, or where there's animals, anytime that is flooded, yeah, of course, there's going to be bacteria and parasites in the water. I mean, that's probably what kills most people from floods and things like that, are the waterborne diseases that occur, afterwards. I mean, some people drown, but most of it is, cholera and these other diseases that occur.
Yeah, and you never hear about that being reported. It,
Yeah, because
it,
it's not as common here, because but it is in less developed countries, where there are bigger floods, and there aren't as many resources to help people.
yeah, because what brought my attention to it is a few years ago when there was this flooding in Texas, like they talked about this woman contracting lepto.
Spirosis.
Yes.
Yeah,
So then that made me think more about it.
yeah, yeah. No, that can happen.
You guys are talking way over my head. I don't even have
Uh,
any clue as to what that illness is. Um,
Think about it as
yeah.
little worms. Yes.
Oh, nice. Thanks. Now I understand why you didn't mention it. That's funny. Um, so it's like so sad that the marginalized communities have to deal with all the impacts of all these things. Do you have any, like, besides moving out of the area, like some things that people can do, or to like increase their health, or their lungs, or their um
Well, they're trying to get more monitoring of the refineries, right? So there was a bill that went through the legislature to monitor these communities, to have, so that they know if there's bad air and if there's emissions from the refineries, because they don't always report them. They're
right.
supposed to, but they don't always do that. So it's called fence line monitoring, and that was supposed to go through. And I must admit, I don't think that Gavin Newsom signed it, or maybe it's still on his desk. I don't think he has signed
He
it yet.
vetoed it.
Did he veto it? Okay,
Oh,
so
no.
It was really disgusting.
yeah, I
He
thought
vetoed all the drilling too, right? On
he
the
let
coast?
them, yeah, that was a little more complicated. I think he let them have a lot more time to comply with this, 8 years instead of 2 or 3 years. And that's sort of still in some negotiations. Does that sound right, Jack? That they're,
I'm not sure about that one.
yeah, so the setbacks from oil and gas drilling, that was really disappointing because it was passed, a law was passed, and then the fossil fuel company spent $20 million or more paying for signatures to negate that bill. I don't know the exact process. So then it was going to go as a proposition this year. And then at the last minute, there's a negotiation, so they took it off. So it's not a proposition this year, but Newsom gave them many years, 6 or 7 or 8 years to implement that instead of stopping the ban right away. So,
Mhm.
and that's sort of in some negotiations right now. So yeah, I mean, Newsom has not been the climate champion that we want him to be.
Yeah. Go
But we've
ahead,
got
Tom.
got to keep the heat on.
I had a quick comment was when you talked about the billion-dollar disasters, I'm assuming that those are inflation adjusted because obviously 20 years ago, a billion was a different number than it is today.
Yes, yeah.
And I don't know if you saw, I think it was today in the East Bay Times, there was an interesting article about some of the less commonly reported impacts of climate change. And they were talking about the crime rate goes up when it's hot. And, I thought that was interesting. And we've talked about this, learning goes down. I mean, you just can't, schools, especially low income schools that don't have air conditioning, the students just can't learn as well when it's hot. And I think we all know that's true. I mean, how you can't concentrate when it's hot. So those are some things that have huge health and economic implications, but they aren't commonly tracked, as much. Well, the article did talk about the air pollution from the wildfires, but there again, I don't know how carefully that's tracked. It's kind of like those resultant flood consequences, which aren't, people don't necessarily follow something that's way down the line. I did have another comment though. The China picture that you showed, I remember when the Olympics were in China, it was kind of a national embarrassment for them, the fact that there was so much pollution. And they've
Yeah.
really, I think your slide told the story, but it's even better than that because they have really been going incredibly fast on implementing wind and solar. Like I was just reading that 2/3 of all the wind and solar in the world that's under construction now is in China. I mean, they are really moving fast to clean up their air. And I understand there are a lot more blue sky days in Beijing now. And so it's really having an effect. And I just think, there's so much China bashing that goes on. It would be so great if the US and China would work together on the climate issue as something that, that could benefit the whole world instead of just fighting with each other over trade policies and stuff like that, But that's, I think, something that we as people concerned about the climate should give China a lot of credit for taking a lot of leadership.
Mixed, it's a bit of a mixed bag. I agree with you completely. We should be working together, but that's they also are building more they are building more coal-fired plants,
Mm.
in China and elsewhere around the world. So they're building more and more and more of those as well. So yes, they're putting up more solar and that's great, but they're also building a lot of.
Yeah, I think that they're involved in one of the things that 350.org is very opposed to, which is this East Africa pipeline. I'm not quite positive what their role is in it, but they are funding some bad projects. But one thing I did read about their coal plants that they're building is that they are building them as peaker plants, which means they're not really built to run all the time. They're building them for like nights and cloudy days and stuff like that. They really do have a goal of topping out their coal
Mhm.
consumption in the next year or so. And
Mhm.
if that's a big if, but if they do that, that'll be a tremendous accomplishment and a really good news for the world.
Agreed. We are headed in the right direction. It needs to be faster, to be better or faster. But yeah, with with solar and wind, especially solar, um, the getting cheaper and cheaper. I mean, that's really a huge help. Yeah.
I have another question. I was wondering if you had any info on like wars and all the chemicals and particulate matter that goes out into the atmosphere. Maybe not in the war zone, but like come on, maybe trickles over here or some other country like that.
I don't have any statistics about that. I mean, of course, it's bad. I mean, you know, yeah, if
Yeah.
we stop fighting wars, there would be so many great benefits. But yes, there's,
So many.
it's the wars themselves and everything, but then it's the having to rebuild everything and all the resources that go into that. So
Right.
it's just endless. So that's why sometimes you just got to focus on the good things that you can, like Jack was talking about, China's producing a lot more solar and building more solar, and you have to be happy for those things and be positive about those things.
Find joy where you can find joy.
Exactly. Right.
Yeah. Wow.
Oh,
Does
just one
anybody
other
else
thought.
have? Go
Can I
ahead.
add one other thing? It was when you were talking about the fence line communities, I did want to point out that 350 Bay Area was involved in this project this year to do a pilot with putting portable heat pump air filters in houses. And we also distributed a lot of clean air filters out near Martinez, near the refinery. And so that's one thing that people that do live near in those communities can take advantage of is clean air from filters and heat pumps that can provide air conditioning. It obviously doesn't solve the problem for somebody that has to be outdoors, but it could improve, the air quality, especially for people that have asthma and stuff that are living near those facilities. And you were asking Cheryl, what can people do? I know it's just terrible. It's like living in Cancer Alley in Louisiana, like
Mhm.
it's almost like a
Yeah.
death sentence if you just happen to be born in a place like that. And it's always a racial injustice because you can pretty much predict that it's going to be people of color that are living in those places like that. So, I mean, there's a tremendous social injustice with where the people are near those pollution sources.
Agreed.
And then one last question I had, do you have like, is there any like push to get like methane from cows, like, or farmers or ranchers or whoever those people are, to reduce, or I know that would be great if they could just, but anyway, go away. But they put out so much methane, and I was curious if there's any like movement there.
A couple of things. If you feed I mean, there are some additives, right? There's some seaweed that you can feed the
Mhm.
cows and it decreases their methane, the amount that they emit. The problem is they don't they lose weight. They lose some weight. So
Mm,
you're not gonna convince people farmers to have, to feed them something that's not going to be making it as much as profit for them,
money.
as
Mhm.
much, unfortunately. There are some studies about looking at the gut bacteria and changing that, etc. People got to stop eating meat. I mean, you just got to eat less meat. It's just not that hard, but I don't know how you spread that message, no politician's going to do it, no organization's, going to do it. It's
Well, it's
one of those
funny because
frustrating things. So, that's how you solve the problem. You eat less meat, and then the cows don't deforest the land. I mean, you guys probably all go out hiking, and most of the land around here is all is all grazed from, from cattle. I don't know. That's, I hate to be a downer, but you just, that's the solution, right? Eat
No,
less,
I think
right?
that's a good solution. I
And
haven't gotten there yet, but I
I
do
mean,
reduce my
and there's
intake.
and there's good alternatives, right? There
Hmm.
really are good, meat alternatives. I think they taste pretty good, but it's just, and it's state of mind in our country sometimes. So,
Yeah. Well, yeah. Thank you so much. That's been such a
Um,
great experience to
yeah,
learn all this stuff. Go
yeah.
ahead.
so Jack just kind of prompted me when he talked about heat, and so I'm thinking about heat and aggression and increase in domestic violence. But along with that is also like what they call eco-anxiety. So is your group also moving
Mhm.
towards addressing mental health issues with
Yes. Yes.
climate?
Yeah, there are several people in mental health who are doing that. Yes, in our groups. I'm not one of them, but yes, there's a lot of that. Absolutely.
Yeah, it seems like I feel like since I'm a former council member in Berkeley, so that was something that I was always talking about was mental health, and I was on the mental health commission, and I feel I don't know, I don't think cities are doing enough to address that, and I feel there's gonna the way things are going in this country right now, um, mental health issues have been elevating, right? And I feel there's going to be a explosion at some point, especially with the genocide and how people are feeling about all these things that they thought were cool and not, and now they realize they were like the worst things ever, corporate greed, the American dream, that's not quite what they thought it was. And now, so I feel like people's mental health is deteriorating on some level with after COVID too, and even with the COVID remnants that are still going on, so yeah.
Yep.
Well, that's good that you guys are addressing it. Well,
Mhm.
I
Yeah.
think that's all we have for unless anybody else has a question. Do you have one, Colleen?
The only thing I could think of to offer, as a citizen out here is if I give up the car I love and go electric, is that a big contribution? I think I just need to stop eating beef.
That too.
That would be
Uh,
the better one.
yeah, actually, number one actually is flying less.
Flying
One,
less.
yeah,
Oh,
one airplane flight is about the same as going vegan for a year.
Wow.
Yes, yeah, really,
wow.
really quite dramatic. And same thing with an electric car. No, electric, everything matters. Flying has probably the biggest footprint, the individual footprint of it of anything else.
Very
Wow.
Yeah.
interesting.
But certainly, yeah, I mean, if you can afford to and get an electric car or a hybrid, um, that's obviously great, eating less red meat, but flying is actually the most that anybody can do.
The biggest.
Mhm.
And that's so interesting.
Yeah,
Thank you.
yeah.
Wow. Well, they got to come up with some better transportation to get from one country to another then,
Yeah.
besides that boat that's going to take a week to get there.
Yeah, yeah.
And I don't know about an electric plane. I don't know. I mean, it would
Yeah, they're
have to
getting
be
there.
a decade at least before I got in one. I don't know.
Yeah.
But yeah, well, thank you so
All
much.
right. Well, thank you. I really, really appreciate the opportunity and have a great meeting on Friday.
Thank
Thank
you
you
Yeah,
very
and I
very
was
much.
much.
wondering
That
if
was really
it's
great.
all possible to get your slides to share with the CEMTF
Sure.
list
Mhm.
because they were so informative and this